Everyone, and welcome. We're so excited to have you here today with us. I am joined today by Dr. Milica McDowell. Dr. McDowell is a physical therapist who will be joining us for Rehab Summit this year. So we're so excited to have her. She is the head of education over at Fringe, and she's here today to speak with us about red light therapy. So excited to have you, Melissa. If you don't mind coming on and just sharing a little bit more about yourself, Fringe, and what you're doing over there.
Thanks, Evan. Thanks, everybody, for checking out our little information today about red light therapy. As Evan said, I'm a doctor of physical therapy. I am based in Bozeman, Montana, and I am part of the education team at Fringe. So my biggest job is helping educate health pros, educate consumers, get everybody fired up about the products that we build and the education that we create. We want to make sure everyone knows the science behind the technology. So I'm super pumped to answer questions today. You guys can reach me at Melissa@Join Fringe if you have any sort of questions via email. And let's do this, Ev. I'm pumped.
Perfect. Let's jump right into it. So the first question I want to ask you that we're all curious to hear about is, what is all the buzz about red light therapy?
So red light therapy is basically harnessing the healing power of the sun. Yes, the sun outdoors. So when you look at sunlight, sunlight is every wavelength, which is every color: red, blue, indigo, violet, all those amazing colors of the rainbow. What we know is that red light has tons of therapeutic indications. Many of you have probably heard you can use it for pain, inflammation, you can use it for sleep, you can use it for fat blasting. There are cancer indications, bone healing indications. So the buzz is warranted, my friend. People have been talking about using the sun for hundreds of years. In fact, there was a scientist in the early 1900s who won the Nobel Prize in medicine. His name was Niels Finsen, if you want to look him up, using the sun to heal different types of wounds. Awesome research from a zillion years ago. So the buzz is warranted. This has been an ancient medicine that we are harnessing in modern day to solve some of the problems our modern day humans are struggling with.
I love that. And, I guess the next question that I want to go into with you is, we're talking about light here. And I imagine, a lot of people are probably thinking the same thing, but can something as simple as light actually improve patient outcomes?
Great question. So some of the things that we love about red light therapy is you can use it for self-care. So right here, I've got Fringe's red light wrap. We have numerous types of wraps. This is called our small wrap. This is fantastic for limbs, shoulder, elbow, around your wrist. If you're a smaller person, this could work on your low back or your abdomen. This would be great for your calf or your foot. We believe that teaching people about how to use these types of tools for self-care at home can be an amazing way to help patient outcomes. And then we also have tools like this. So this is our red light panel. This is the type of thing I would recommend if you're a clinician to go ahead and use in your office. It looks like my power strip is not plugged in. Let's try that again.
There we go.
There we go. Oh, plug it in, Melissa. Here we go. Come on. Oh, she's making noise. So I don't know if you guys can see that, but we've got our, there it is.
Oh, there it goes.
The red light panel is working. So the panel is awesome for clinical indications. As I said, I'm a physical therapist. So we use this in conjunction with a lot of other treatments in the office. So as you might imagine, you could prop this up next to a treatment table while you're doing manual therapy, while you're doing eye stim, while you're doing scar mobilization. Red light is phenomenal for pain, inflammation, wound healing, scar, helping with collagen production to heal wounds. And so using a panel like this in the clinic can be phenomenal for patient outcomes. So I like the panel for the clinic. I like the wrap for self-care and home care.
Perfect. And you touched on, a lot of, different therapies modalities there, whether it's, manual therapies, and we'll talk into this a little bit more later when it kind of comes to treatment stacking. But the real question I want to dive into now is kind of, looking in that outpatient therapy clinics and a lot of people that might be using this, and then we'll kind of jump into some other areas as well. But in the outpatient setting, what are some examples of, what clinicians would and should be using red light therapy for? And could you provide some examples for us?
Absolutely. So as I said, I'm an orthopedic sports med physical therapist. We see a lot of post-op in our clinic: total knees, ACLs, rotator cuffs, back surgeries, you name it. We also see chronic conditions, athletes with rotator cuff tendonitis, plantar fasciosis, all those different types of chronic problems. So I like to talk and educate my patients first about why red light can help, because once they're bought in, obviously it can be more helpful stacking it with other treatments. So in the outpatient setting, I like to start by just basically teaching them, look, you've got these little chromophores, which are like tiny little sponges throughout a bunch of different tissues in your body. They are little receptors that want light. And if we're not getting enough sunlight outdoors, we need to supplement that light, which is why red light therapy is a phenomenal, safe, and effective thing to add to your treatment. So in the outpatient setting, I typically start with a little patient education, ask them if they've ever heard of red light therapy before, maybe they've tried it somewhere else, massage therapy, chiropractic, acupuncture, something like that. And then in our clinic, what we like to do, we use it for pain and inflammation for post-op folks. So those days where you're getting those total knees, ACLs, post-op shoulders in, we're undressing the bandages, examining the wounds, providing patient education. That's a great stack to add on while you're doing all those other things, because what it's doing is it's helping push away inflammation. It's actually helping activate the healing process. Can be really great for collagen, can be really great for scar healing. And so very minimally invasive thing that you can add. There's very little downside to incorporating it. So that's kind of how we use it in outpatient for acute problems. When we flip the table and we kind of look at the folks who have more chronic conditions, using it in the clinic can be really helpful for creating a little downtime, having someone work on maybe some breathing or down regulation exercises while they're doing a little red light work, perhaps before they do therapeutic exercise with one of the therapists. We do like to train people to use them at home. I think a red light wrap is a phenomenal self-care device that as a clinician, you can recommend and sell to your patients, give them those tools to use it at home. And so those are really the two ways that we tend to incorporate it in our outpatient clinic. And I see we have a question. We've got a LinkedIn question that says, is it accessible? Can people do this at home reliably? Just like asking them to do their home exercises, that is a huge yes in my book. I really am a big believer in great communication between the therapist and the patient, so that therapeutic alliance of being on their team, and then educating them. What's the benefit? So why would I take this thing and say, look, if you use this for 20 minutes a night on top of the exercises I've given you, you're getting like double bang for your buck. It's a way to upgrade and elevate your treatment and your rehab. And so I feel like because there's such little downside, so few contraindications, very little risk, it's definitely something that I think if you have good patient communication, you can do a great job of teaching them why this will create benefit for them.
Perfect. And one thing I want to talk about now is, we touched on, the benefits, the indications for red light therapy, how this can help. But I also want to touch on the opposite side of that, which is also looking at some of the contraindications and
Absolutely.
things that you might then in the clinic be looking out for and when you're thinking about using red light therapy on patients.
Yeah, for sure. So we definitely have some screening questions that we recommend. If someone is sun sensitive, or they're taking any medications that make them more sun sensitive. So one of the misconceptions about red light treatment tools like this is that whether they could create a sunburn. So this does not have UVA and UVB wavelengths. Those are the harmful rays of the sun. So this is just red light and near infrared light. Just two wavelengths are on these panels and wraps. And so you really don't have any risk of sunburn, unless you're someone who is incredibly maybe fair-skinned or you're taking a medication that makes you photosensitive. We like to say if you can spend 20 minutes outside without getting red or without getting sun irritation, red light therapy should be safe for you. There are some other contraindications. Active cancers is one. That's another one where we really just, don't want to do any things to activate those cells that folks are fighting against. And so that's another area where we definitely recommend that someone would speak with their doctor if they're in some sort of cancer treatment and looking to see if maybe there's a way they could use it. But we definitely don't recommend you would use it over an active cancer site.
And the next question that I want to get into with you, and you touched on this, and I want to dig a little bit deeper, and it goes into treatment stacking, right? And treatment stacking, for a lot of clinicians that, are working with patients, it's how can I maximize my time and being able to then increase or improve functional outcomes with these patients, right? So when kind of looking at treatment stacking, what are some options of using red light therapy, and how could, I guess, some examples of how a clinician might be able to use this and stack this with other modalities or treatment approaches that they're using?
Okay, so everyone take a deep breath. We're going to talk about biochem for just a second. So part of what happens underneath your skin when you use red light therapy, either a panel or a wrap, is we pump up your mitochondria. So if you guys remember mitochondria from biochem, they are the powerhouses of the cell. Your mitochondria have little channels in them, and those little channels are chromophores. They're sponges that want light. They're seeking light for energy. When we shine red light onto a human through the skin into the mitochondria, we pump up ATP production. And as you guys all know, ATP is the fuel and the power that runs our bodies. When you're out of ATP, you are on the couch. So when we think about that from a biochem perspective, we know that when we incorporate red light, we're pumping up that ATP. Another biochem factor, I'm only going to give you two because I don't want to go too deep into the biochem. There's more where this comes from in our course, which is launching on August 14th. But at any rate, we've got the ATP production. The other positive biochem element with red light therapy is it reduces some of the byproducts and bad things that happen in our cells. Reactive oxygen species, it buffers nitrous oxide. It really helps our cells function more optimally. So we've got a pump up of ATP, a decrease of the bad stuff, which makes us more optimally ready to train, to progress, and to heal. So with that, in the clinic, you can use, especially like the panel. I love to take the panel, set it on the table while folks are working on table exercises. When you've got somebody who's freshly post-op and we're just trying to get that darn quad to fire, we're trying to get them to be able to, reset those shoulder blades, activate the rhomboids. This is a great way to bump up that treatment and again, kind of get that double bang for your buck, get a synergistic effect, stacking this on top of therapeutic exercise. In our course, we talk a ton about recovery and performance indications for red light therapy. On the performance side, using this before work, sport, training, rehab, definitely has tons of research articles, tons of data behind it, that this can act in a synergistic fashion to give you better outcomes from a biochem and hormonal perspective. So I promise I'll stop with the chemistry there, but what's really exciting about this is if you are in an environment where you're working to build people up, maybe they're post-stroke, maybe you're in the neuro rehab centers, maybe you're orthopedic like I am, you're working on really getting people to restore that function. This is very little downside, very, very low risk, and tons of upside to help them get better faster.
Love it.
Let's see. Someone asked, is this a webinar or a commercial? Well, of course, I'm going to tell you that I think these products are phenomenal. That's kind of a funny comment. This is a webinar. Our goal is to educate you about the benefits of red light therapy, how it works, what the science is. But of course, I'm going to tell you that my course is phenomenal and this product is great because I believe that. I wouldn't be sitting here if I didn't believe that. So funny comment. Thanks for sharing that.
And when we dove deep there, and I personally love the biochem. I think it's part of understanding that is part of understanding then how you're helping your patients, right?
Right.
Want to go a little bit more into when you're using red light therapy. Obviously, it's seeing you there as simple as plugging it in. There's light emitting, but I want to kind of go a little bit deeper in patients are using this, clinicians. How long should they be using red light therapy? Are there certain settings, parameters? Indications versus infrared or far infrared. How does that work when you're a clinician looking at using it on a patient?
Great question. So when we talk about red light that we can see in the visible red spectrum, you are getting either it's between 660 and 880 nanometers as your wavelength. When we get into the near infrared, we can't see that visually. So if I was to turn the near infrared on our panel, you don't see any color. That's in the 1,000 nanometer wavelength. So the red light is between 660 and 880, give or take. And then the near infrared is about 1,000 or greater. So we know wavelength is the most important element because if I said, oh, I've got a LED that's giving me 400, that would be giving me it would be giving me yellow light. If I had something giving me 500, that would be giving me green light. And so the wavelength really dictates what color we see. So when we're dealing with red light therapy, we are working in that 600 to 800, like 660 to 880 nanometers of wavelength. So that's one important element. The second important element is power, and power is calculated by the number of LEDs, how many LED diodes are on the panels or the wrap or whatever piece of equipment you're using, times, so it's the power, and then we look at time as well. And so we've got wavelength, we've got power, and we've got time. What's interesting about any sort of light therapy, whether that's blue light for acne, red light for inflammation, yellow light for soothing, whatever wavelength we're using, all light therapy has a biphasic response, which means it's the Goldilocks concept. Too little, too much, right in the middle is the sweet spot. And so we know that we don't get enough of a therapeutic outcome if we have too little exposure. We know that we can have not an optimal therapeutic outcome if we have too much exposure. So there's a sweet spot in the middle. Most of the data suggests that the sweet spot is around 20 minutes. And so most red light therapy products that are designed either for clinical use or for clinicians to have home use have a 20-minute timer on them, because that's really what the data indicates. So if you're looking at parameters and we're looking at red light, the wavelength is between 660 and 880. We're generally looking at about 50 watts per square centimeter as the power. We're typically looking at about a 20-minute treatment time. But for those of us who are maybe a little bit more fair, you might start with 10 minutes and just make sure that your skin tolerates it okay.
Perfect. So find the sweet spot. And it looks like we had someone comment, I love RLT, been using it on and off for over 10 years. I'm 42 and people think I am 28 all the time. I love that. I imagine, and just hearing all the things you're talking about, from ATP production, inflammation, tissue health, cellular metabolism. I imagine there's a lot of things that are happening there from, a cosmetic standpoint too. Last thing that I want to jump in with you here is, in talking about some of those things, we see this, we talk about the outpatient, clinic population. We're talking about athletes, reducing inflammation, things of that nature. But I also just want to touch on special patient populations. So kind of looking outside of that. So maybe looking into your neuro population, how could red light therapy work for those individuals? And maybe that's something you can speak on.
Absolutely. So I'm in the process right now of course development for a red light therapy neuro indications class. We're going to be talking about all the evidence-based indications for red light related to neuro. Alzheimer's, Parkinson's, anxiety, depression, post-stroke, migraine headache, and neuropathy. And so in that course, we are diving really deep into those neuro special populations. As most of you know that are clinicians, if you're following along, most of our Alzheimer's dementia population, Parkinson's population tends to trend a little bit older. We do know that for geriatric skin, as long as they're not on any sort of photosensitivity medicines, most of them tolerate red light just fine. Same with pediatrics. I wouldn't necessarily blast a baby with red light therapy. I don't know that there's a lot of data suggesting that that's maybe the safest choice. I know we put jaundice babies in direct sunlight, but from a red light therapy standpoint, I haven't read any articles that are in really early pediatrics. But for the rest of the special populations, there's some really great indications for pre and postpartum moms for anxiety, depression, and sleep disruption. We've got some really good wound healing data for amputation. We've got some really good wound healing data for diabetic neuropathy. And let's see, trying to think of the other ones. There's all kinds of really interesting indications. Oh, to kind of bounce it off the comment that we just put up, there are tons of cosmetic indications. So I'm actually also one of the primary authors in another course we're working on right now that's called Red Light Therapy Cosmetic Science. We're looking at clinical and cosmetic indications for skin. So if you have been using it for collagen and or wrinkle reduction or photo aging, you're actually right alongside with the science. There's a ton of indications for that. And just kind of stay tuned, because Fringe University is where all of our classes live, and that's where that information will be.
Love it. And Melissa, Rehab Summit's coming up in October towards the end. You're going to be there with Fringe. You're going to be talking more about red light therapy. We're super excited. But for anybody here today that's like, hey, I'm really just intrigued by what I've learned today and I want to learn more, where can they go to learn more? I know you talked about, Fringe coming out with some courses that you've authored and are working on, but where can they find that information? Where can they get connected in to learn more?
Absolutely. So Fringe is all about community, right? So the biggest, there's 3 pillars of Fringe, and it's basically using old science to solve modern problems and building a community of people who care about each other and are supportive, which is a phenomenal aspect of the Fringe ecosystem. So our website is fringeheals.com. Our education platform is fringe-u.com. That's where all of our on-demand courses live. You can reach out to me, Melissa, at joinfringe.com on email. My first name is Milica, because my family is Yugoslavian. So I would love to connect with any of you. We've got some really awesome clinicians on our team. We've got everybody from chiropractors to acupuncturists to mental health folks and physical therapists, athletic trainers, massage therapists, just a really phenomenal group of health practitioners and people in the wellness space that just want to help share information and get folks understanding that, there's a lot of self-care and healing that we can teach folks to do themselves. And that's really what those products are about.
Dr. McDowell, thank you so much for being here and sharing your time with us today. I really appreciate you having you on, sharing more about red light therapy. Super excited to be seeing you in Vegas in October.
Yeah.
And learning more.
Awesome. Thanks for the feedback, Deb. I appreciate it. Keisha, thanks for weighing in as well. I love getting comments from folks that are following along in the audience. And those of you that are coming to Rehab Summit, I'm pretty sure I'm on the hook for teaching the workouts in the morning. So you can come see me at the Fringe booth, or you can come meet me for a good sweat early in the morning.
Oh,
So thanks, everybody.